Hi my friends, my name is Sam and this is another video of Everything You Need to Know series. Please subscribe to my channel if you find it useful. This time I want to talk about a medicine that is usually prescribed to control hypertension. First, let's hear its pronunciation. Lisinopril. Lisinopril. Of course, lisinopril is also correct. The black box, the high-level warning about lisinopril, is to stop it if you discover that you are pregnant. Lisinopril belongs to a group of medicines called ACEI. For taking a glance at its mechanism of action, first I should explain renin-angiotensin-aldosterone system, or ROS in brief. One of the ways in which our body naturally increases the blood pressure and controls the fluid balance is through ROS. It starts from angiotensinogen, a protein that liver releases. Renin catalyzes the conversion of angiotensinogen to angiotensin 1. Then an enzyme called angiotensin converting enzyme, or ACE, catalyzes converting angiotensin 1 to angiotensin 2, which can finally cause vasoconstriction and adding fluid volume, two actions that result in increasing blood pressure. Now, what does lisinopril do? It inhibits ACE and stops this system. Lisinopril is available as tablet in different doses: 2.5, 5, 10, 20, 30, and 40. And the oral solution has just one dose, 1 mg per milliliter. Lisinopril can be used in acute coronary syndrome, heart failure with reduced ejection fraction, chronic hypertension. It also can be prescribed as off-label use in post-transplant erythrocytosis and in proteinuric chronic kidney disease. In children who are 6 or more and in adolescents with creatinine clearance of less than 30, use is not recommended. In adults with the same creatinine clearance and those who are under dialysis, the dose needs to be adjusted. But in hepatic impairment, no dose adjustment is needed. Just use it with caution. Keep in mind that in older patients, the initial doses are usually less than normal. In both dosage forms, administer lisinopril as a single daily dose and without regard to meals. Significant adverse reactions are acute kidney injury, angioedema, cough, and hyperkalemia. Remember that coughing is one of the main adverse reactions of lisinopril. It usually occurs after 1 month, but in some cases may be delayed until 6 months. Statistics says that it's a tiny bit more common in females. If you experience coughing while you're under lisinopril, you should consult your physician to switch your medicine. Hypotension and dizziness are adverse reactions with a frequency of greater than 10%. A vast majority of adverse reactions have the frequency of less than 10%. In pregnancy, lisinopril is not recommended and human data suggests risk, especially in the 2nd and 3rd trimesters. And in breastfeeding, the American texts say that it's probably compatible. Of course, Canadian texts categorize it as contraindicated. What about drug and food drug considerations? You should avoid combination of lisinopril with these medicines. Sacubitril or any combination drug that contains sacubitril. This also is true about bromperidol and 5-grass extract, also known as grass pollen allergen extract. Use potassium-containing salt substitutes cautiously in patients with diabetes, patients with renal impairment, or those maintained on potassium supplements or potassium-sparing diuretics. When isn't lisinopril a suitable choice and has to be avoided? In hypersensitivity to lisinopril, other ACE inhibitors or any component of the formulation. Angioedema related to previous treatment with an ACE inhibitor, idiopathic or hereditary angioedema, concomitant use with aliskiren in patients with diabetes mellitus, administration with or within 36 hours of switching to or from a neprilysin inhibitor like sacubitril. Consider that in Canadian labeling there are also some other contraindications like pregnancy, breastfeeding, and concomitant use of a few drugs like aliskiren. Let's take a look at the most famous brand names of Lisinopril. They are Zestril, Prevanil, Cuberlis, Dopril, Dosteril, Lisopris, Linopril, and Enopril. Well, although everything I told you about Lisinopril was evidence-based, this video is just for improving your knowledge, so it's not a viable alternative to your healthcare provider. And finally, if you enjoyed watching this video, please subscribe to my channel now and press the bell button below to be informed every time I upload a new video. Until next time.